Hi there, my name is Andrew Vandenberg. I'm currently a second year physical therapy student at Campbell University, as well as a licensed athletic trainer. Welcome to my 5-part video series on how to perform VOMS testing and how to prescribe exercises for return to sport afterwards. I hope you enjoy. So, the next portion of the VOMS testing that we're going to be completing is the visual ocular reflex portion of it, otherwise known as the VOR. This is completed both horizontally and vertically. How I'd instruct my athlete is I would tell her to stand squared like that, and go ahead and put your arm all the way out like this, and I want you to focus on your thumbnail the entire time you're doing this test.
Okay.
And my instructions I'm going to give her is I'm going to have a metronome. For this test, the metronome needs to be at 150 beats per minute. And the first portion of the test we're going to do horizontally is she's going to shake her head like she's shaking no, left and right, to the beat of the metronome. And so what I'd normally do is I'd normally let the athlete listen for a few seconds to kind of get the beat, and then I'll also kind of just direct them with verbal cues. For horizontal, I'll be saying left, right, left, right. So I'm going to turn the metronome up. I'm going to start it, and I'll let them listen for a second here. And then I'll go ahead and I'll start counting off left, right, left, right, left, right. Go ahead and begin whenever you're ready. Left, right, a little faster, right, left, right, left, right, left, right, left, right, left, right, and stop. Good. I normally let them do, you can rest your hand for a second, about 10 shakes each way there for a total of 20 shakes, 10 to the right, 10 to the left. Again, I'm positioned on the side of her right here at first. If possible, as the examiner, you want to actually be slightly in front so that way you can be looking at her eyes. So I'll do that for the second portion of this test here. Next, we're going to be doing the same thing vertically, Anna, where you're going to have your hands straight out in front of you, but now you're going to be nodding your head like you're shaking yes and no.
Okay.
And the only difference is with my cues, now I'm going to say up, down, up, down, up, down, up, down. So once again, I'll start the metronome. I'll let the athlete hear it for a moment or two. I'm looking at her eyes, making sure she's focusing on her thumbnail. And whenever you're ready, you can go up, down, 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 rest. Good. So again, what you're looking for is making sure she can stay focused on her target, making sure that her eyes are staying in the same spot, and it's just her head moving around her eyes, essentially. And then you're going to ask her the same 4 symptom questions that you ask with every portion of VOMS. So then I would ask Anna, did you have any headaches with that? Dizziness with that? Nausea?
No.
Or fogginess?
No.
Good. And you want to make sure that you do that both for the horizontal and the vertical, in between each, because your athlete may have different symptoms with each as well there. So, and that's how you do the VOR portion of VOMS testing. So as we look at Anna's VOR here, what we want to make sure that she does is keep her eyes on her thumb no matter which direction she's moving. As you can see, I have her move both vertically and horizontally here. You want to make sure that her gaze remains fixed on her thumb. Any sort of abnormal would be the eyes not staying still, essentially, because you're essentially just shaking your head about your eyes, and your eyes are staying still and focused on your thumb. So if you see the eyes move in any meaningful direction, that would be a positive, which is, again, indicative of vestibular dysfunction. So, as we see Anna perform this exercise is to improve her VOR while giving her a slightly more functional task. As again, I've said before, with any VOMS exercise, you can just continue to perform the test to improve their performance at it. However, that doesn't necessarily get the next step or the link between them returning to play and having dysfunction and them having dysfunction at rest in the office. So you can see here I give Anna a small obstacle course to navigate while performing a VOR test. Again, you can make this easier or harder by making the obstacle course more chaotic. And to make it easier, you can have her just walk in a straight line and try to maintain that straight line. But now you can see here, I've taken this exercise up a notch. I'm having Anna do a classic agility pattern found in soccer because she is a soccer player. And so this is much harder for her to do and much harder for her to maintain, but again, puts a more realistic demand on the rest of the body while forcing the eyes to focus on a target, just like she would have to in sport. So I really like this as a good example of a progression from the first exercise I showed to something that can be more sport specific, not just to soccer, but to any sport that requires some agility.